Hello, guys, please take seats. We'll be starting in 15 minutes. Folks outside, Shashi, can you just call them in? Everyone, can you please take your seats? We are starting now.
Everyone, please be seated. We are about to start. We are good to go. Manish. So we'll start in another 5 minutes. A very good afternoon, ladies and gentlemen, and all the dignitaries. May I have your attention, please? The press conference is about to begin. Good afternoon to the dignitaries and friends from the media. Thank you for squeezing in the time to join us today. To grace the occasion, we have with us Dr. Ian Paddock and Ms. Preeta Reddy. Please, madam, come on the stage. Dr. Paddock. Dr. Preeta Reddy is the Executive Vice Chairman of AHEL. And Dr. Madhu S., please. He's the President and CEO of Apollo Hospitals. Mr. Dinesh Madhavan, President Group Oncology and International Apollo Hospital Enterprise Limited. Mr. Harshad Reddy, Director Group Oncology and International AHEL. Dr. Manish Mattu, CEO Karnataka and Central Region, and Dr. Sridhar PS, Lead and Senior Consultant in Radiation Oncology. Please come over. That's okay. The purpose of having this press conference is to introduce you to South Asia's first and most advanced CyberKnife robotic radiosurgery system within academia. Cancer, as you all know, remains the illness most feared across the globe. But to combat these ongoing challenges, cancer diagnostics, techniques, and technology advancements are lowering incidence rates, improving life expectancy, and bringing us closer to cancer care. And we at Apollo Cancer Center have achieved a great level of success in cancer management. Now, we would like to present a bouquet to all the dignitaries on the stage. I would like to call upon Dr. Sandhya to honor Dr. Ian Paddock. Dr. Sandhya. I would like to call upon Dr. Archana to present a bouquet to Dr. Preeta Reddy, please. I would like to call upon Ms. Lekha to honor Dr. Madhu, please. I would like to call upon again Dr. Sandhya to honor Dr. Dinesh Madhavan. And again, Dr. Archana, please come over to honor Mr. Harshad Reddy. In fact, our health minister was supposed to join us today, but because of the unfortunate flood situation which is happening around in Karnataka, he had to be there. And we will be later on playing a short video, what he had to say. But he has told his apology, and we will definitely be looking forward for his video. Okay. Now, I would like to call upon Dr. Manish Mattu, CEO Karnataka and Central Region, Apollo Hospitals, to give a welcome speech. Dr. Manish.
Thank you, Dr. Vikram. Good afternoon, everybody. It is my pleasure to welcome you all. I'm grateful to the dignitaries on the dais, Dr. Ian Paddock, the President of International Stereotactic Radiosurgery Society, Dr. Preeta Reddy, who is our Executive Vice Chairperson, Dr. Madhu Shashidhar, who is President and Group CEO of Apollo Hospitals, Mr. Dinesh Madhavan, President Group Oncology and Apollo International, and Mr. Harshad Reddy, Director Group Oncology and Apollo International. I'd also like to welcome friends from the media and our colleagues from the Apollo family here today. Today is a momentous day for all of us as we launch a groundbreaking technology in cancer care at Apollo Hospitals, Bangalore. As we inaugurate the first CyberKnife, at Apollo Hospitals, Banagata Road, it's also the first CyberKnife with academia as far as South Asia is concerned. This is in line with Apollo's philosophy over the last 4 decades of introducing world-class medical technology in the service of patients in India. And it's also in line with our chairman's clarion call of fighting the menace of non-communicable diseases, particularly cancer. I welcome you all once again and seek your support and good wishes as we take a pledge today to make cancer care safer, more precise, and more effective for our patients using this cutting-edge technology. Thank you so much. I request the dignitaries to come and light the lamp, please.
I would request the dignitaries to be seated because we are about to unveil the magic right now. Okay, I would request Dr. Ian Paddock to please unveil the new CyberKnife. We'll be playing 2 videos. Yeah, it's already. Now that you have seen the technology evolving, we have the actual machine which we are going to unveil virtually. Please. So before we go to the next talk, there's a small message from our Honorable State Health Minister, Mr. Dinesh Gundurao, because he's absent today, and he wants to convey a small message, and he has sent his apologies to us, and virtually he has sent a message across. Please. With a steadfast commitment to pioneering healthcare, Apollo has not only transformed lives, but it has also redefined excellence in various specialties, including oncology. Now, I would like to invite Dr. Madhu S., President and CEO of Apollo Group, to share his thoughts. Dr. Madhu.
Thank you so much. I want to thank the oncology team and the Bangalore team for inviting me here today. Good afternoon, everybody. I had not prepared a speech. I did not know I was going to speak today, but this morning I took the flight from Chennai to Bangalore. Harshad and I were on the same plane. And it's a short flight. It's about 50 minutes, right? Not enough to get any work done, not enough to start reading a book. So I reflected a little bit on my own career because I trained as a pulmonologist, and the first half of my career, I was mostly taking care of lung cancer. So you're talking about the 90s, the 2000s, and so on. And those days, lung cancer was a death sentence, right? Most patients were detected too late. They came in either with local regionally advanced disease or distant metastasis, and care was mostly palliative. See how far we've become now. Lung cancer is no longer a death sentence. We can cure a significant number of lung cancers, which even in the course of my career, if you said that to a patient early on, that would not be true. We are no longer treating patients with chemotherapy like cisplatin and etoposide, right? Very heavy duty chemotherapy agents. They are much, much more precise. We are able to define mutations that respond to therapy, making it much more important that when patients have local control, if they have distant metastasis, we have treatments like CyberKnife. So in the course of my own life, I have seen the treatment of disease change dramatically. Not only the treatment, but even the disease itself. It's no longer just a disease of older people who have smoked a lot throughout their life. As many of you know, increasingly we see young patients, young women, non-smokers with well-differentiated adenocarcinoma, sometimes presenting with brain mets. So the disease itself has changed, and therefore it is important to have far more precise treatment. So it reminded me of many of my patients who did not survive. Right? Throughout the early part of my career, most of these patients with lung cancer were dying with severe pleural effusions or massive hemoptysis, short of breath, on a ventilator. And this is what drives us to do better. This is what drives the medical profession to do better. Because the chain in cancer treatment is only as good as the weakest link in that chain. This is why we invest in the best of technologies. This is why we invest in the best clinicians who can use that technology. This is why, as Apollo Hospitals, we are invested in the best quality and best outcomes for these patients. So today I took a moment to think about those patients, some of whose faces are still visible in my memory. And to me, this is a great moment to be here to see how we are bringing the best of technology to the best of clinicians within Apollo. So thank you all.
Thank you, Dr. Madhu. In an ever-evolving landscape of cancer care, technological advancements continue to drive remarkable progress in treatment and research. One such technology is CyberKnife. To show us a bigger picture, I would like to invite Mr. Dinesh Madhavan, President, Group Oncology and International of Apollo Group of Hospitals, to talk on radiosurgery and CyberKnife. Mr. Dinesh.
Namaste, good afternoon. Dignitaries on the dais and members of this August gathering. It's a pleasure to be here because today we redefine the way we treat cancer. Way back in 2009, India did not have an whole-body robotic radiosurgery system, and it's the vision of our chairman that he thought about how technologies can make a difference to cancer patients, and that's when we partnered with Accuray. So the team from Accuray over here, that's when the journey started to have India's first whole-body robotic radiosurgery system, when it wasn't seen in most of the LMLC countries and was not even seen in some of the advanced countries. But from 2009 to 2023, when we looked at our journey, having completed over 4,000-5,000 cancer patients treated on the robotic radiosurgery system, we look back and try to understand what are we reinventing here, what are we redefining? That's when the Accurate team came back and said, we have a new system which is far more superior and actually creates an outcome and helps clinicians to actually provide the best of care. And we got into discussions with them to introduce again to India by Apollo after a spare of 15 years, the S7 system which you got to see the unveiling of it. This was in Chennai about a few months back. And we looked at it and said, can India have one simple radiosurgical system, or should we have multiple of them? And the thought came that Bangalore needs to redefine the space and try to understand, could we have a multi-location opportunity to introduce this for some of the best of radiation oncologists who are sitting to my right to unlock the expertise of this particular technology. And that's when we, with Accurate, partnered and have introduced the system here today. It's the first in the region, the first in Karnataka. During the discussion, we also realized there's a lacuna and there's something that we haven't addressed and we should take the leadership and be the pioneers, is to set up the robotic radiosurgery school and create the next futuristic clinicians who could unlock this potential of this. So what we're doing in the robotic radiosurgery system is not only innovating, pioneering, introducing such technologies, but also partnering with Accurate to make sure that clinicians get to train, educate, use the technology, and probably go back and look at further installations in India for a population of 1.4 billion with such a huge cancer burden. While we pioneer and we continue to lead by example, we are also creating the future leaders across India, and that to me is very remarkable, and that's what Apollo is doing for the future of cancer care. Thank you.
Thank you, Mr. Dinesh. We at Apollo Hospitals have come up with quicker, innovative models to deliver qualitative healthcare. To give us an insight into Apollo's dedication to excellence and innovation, I would request our ever-dynamic Ms. Preeta Reddy, Executive Vice Chairman, Apollo Group, to talk about innovation and Apollo. Madam, please.
Namaste. It's a pleasure to welcome Dr. Ian, and thank you for being our chief guest and doing the honors. My colleagues on the dais, Dr. Madhu, Dinesh, Harshad, it's always a pleasure to interact with you. When we speak about innovation and growth, I think it's this team which kind of powers the growth, along with our chairman and my sisters who are my colleagues. So I think the Apollo Hospitals feels very blessed to be here with you. And I want to acknowledge the presence of all our senior clinicians in the gathering. Ours is a very doctor-driven organization. And if it isn't for the power, the knowledge, the expertise of our doctors and our clinicians, I don't think Apollo would have been able to do what it has done in the 42 years where we have been in the business. But as I always say, we're in the business of caring. And if we get the caring right, the business follows. And that has been the Apollo ethos from the time we started. And nothing will change as far as that goes, and we continue to do it. For the members of the media and the press, I must thank you all for your presence and for the fact that the Apollo journey has always been supported by the members of the press and the media. And if you did not communicate, if you did not help us in our journey, I don't think we would have been able to touch over 20 million lives, which we have done over the past years of functioning. Today our focus is on cancer, and I must say that it's a formidable challenge. And we all know that 1 among 6 people right now will be struck with this disease. That's what the data shows. And it's a data which we all have to be concerned and worried about. And only responsible organizations coming forward to see what can we do with bringing the best of class technology to bring together the best of class of knowledge and learning and research. I think only when all this comes together can we go out and tell people that cancer is actually conquerable. And that is the underlying reason why we focus on technology, we focus on innovation, we focus on clinical excellence, only because it's the outcomes which matter. To the family members and to the patients who trust us, I think this is a commitment which every organization has to do, and we will consistently and continue to do that as we go forward. I'm delighted that the team, led by both Dinesh and Harshad, and supported by Manish, who is our group CEO, has put together this equipment, helped install this equipment as fast as they could. So thank you all for doing that, and I would like to congratulate the entire team. And I said earlier that if it's not for the clinicians, no program will succeed. So thank you all for being part of this crusade against cancer to all our doctors. And I would like to say today that, you know, we dare to dream. And when we talk about innovation, I think we do it in multiple formats. And a few examples of that is, you know, when chairman told us that we should set up a proton center in India for this part of the world, it was a huge investment. And it did cause a lot of concern. It took 3 board meetings to even convince our board members that it's a worthwhile investment. And when we did that, I'm so proud of the team and the support that they've had, that we have treated 2,000 patients on the proton machine. And I think that has been a great feat, a humongous feat. The same thing, the first CyberKnife actually came to Chennai again, to our cancer hospital. And now we're getting the state-of-the-art CyberKnife, and I'm sure that it will make a difference in people's lives. Like Dr. Madhu said, lung cancer, cancers of the brain, the head and neck, throat, multiple reasons why we should be using this technology, and I think our doctors will do it phenomenally well. And while I was saying, you know, the excitement to do more is what drives us, we've said, we've done very well with the proton machine, and it's as busy as it can be. And we're looking to do 3 more proton machines in this part of the world. And I think India needs it, you know. I'm sure Bangalore will have one as soon as we can get. And so you will have Hyderabad, Gurgaon, and Bangalore, Delhi and Bangalore, the NCR. So these are all part of our plans. But another very intrinsic, you know, program which is happening in the oncology space and which is growing in leaps and bounds is in the immunotherapy part. You know, it's where we really use medical oncology, the knowledge of medical oncology to make a difference in people's lives. Again, we set up the first bone marrow transplant unit. We have 2 in Chennai. But I think it's time to do something very significant in Bangalore, and we will do it. We are the largest CAR-T, you know, the most successful CAR-T program in this part of the world now, with the kind of work which has been done by our doctors. So you will see that, you know, even in the immuno-oncology space, that will continue to grow. It is a question of time, and I think now everybody is charged up to do so much more. Maybe we were busy with, you know, all our other building out other hospitals, but there's a deep focus in the city of Bangalore. Number one is because it's a beautiful city that never changes. Your weather is far better than where I come from, which is Chennai. But more than anything else, the brain power, the innovative power, the power to take digital, bring it to actuality, you know, take digital, which is not just something in the virtual space, but bring it to people's hands. And that is why Apollo 24/7 has grown humongously. So you really have knowledge, you have access on your fingertips. We have health risk scores, which the rest of the world is now wanting us to implement for them. We're collaborating with Stanford for some of our research work, again in this space, in the digital space. So there's a lot happening with us, but getting back to the fact that we will consistently invest in new technology, not because it feels nice, good, fancy to have just some high tech and new tech in your hands. While we are high tech, we will always be high touch. And being high touch is what Apollo is all about. And if it's going to make a difference in people's lives, if we are going to change the way cancer treatment is done in this part of the world, if we are going to bring best-in-class treatment available globally, and then say, you know, I'm a very proud Indian, but if we can show the rest of the world that it can be done better, at a better price, quicker, faster, because, you know, otherwise there are long waiting lists in, you know, in many parts of the world. If we can provide answers, I think it'll be a journey well taken and a job well done. So thank you all for being here, and thank you for being with us on part of this amazing journey. Thank you.
That was amazing, ma'am. You always make us do the best. Now, coming to the keynote address, I would like to invite our chief guest, Dr. Ian Paddock, who has come all the way from Europe to deliver his keynote address. But before I go ahead with that, I would like to introduce him to everyone. In fact, he's the first physics president of ISRS and recipient of the Fabricant Award. And Dr. Ian leads the British Radiosurgery Society and chairs the ISRS Certification Committee. And he's a leading expert in SRS, that is stereotactic radiosurgery, and he's responsible for 8,000 plus patient treatment and helped in setting up around 100 plus centers globally. Known for creating, he's actually well known in our community of oncology for setting up something called as a Paddock Conformity Index and Gradient Index, and he's renowned authority in this particular subject. And Dr. Ian is currently the faculty of 5 top SRS centers, including the Queen Square and Genesis Center in London. Dr. Paddock.
Thank you, colleagues and friends. Well, it's a pleasure to be here. It's 16 years since I was last in India, and it's really great to be back. I want to congratulate the Apollo Hospitals Group for believing and investing in this technology, because this is really important. There are so many developments in the field of cancer, and the future is bright for patients that succumb, or at least suffer from this disease. And today, I think for the 20 million inhabitants of Bangalore, today has got just a little bit brighter, because there's a new technology in this city that's going to help hundreds and hundreds of patients. So, some of you might be wondering, what exactly does the CyberKnife do? I mean, we can see that it's a beautiful machine. It looks like the future. But why is it so good? Well, what we're trying to do in radiosurgery is target the tumor so precisely that every photon in our treatment beam passes through the tumor and does some damage. Now, in conventional radiation therapy, that's very difficult to do, because the treatment is not as accurate, the beam is not as accurate, and so you need to add what we call margins. So you actually treat a larger area than the tumor itself. And when you do that, you're treating more normal tissue, and normal tissue gets damaged by the radiation as well. But the more accurate you can be, the smaller the margin, to the point where actually with the CyberKnife you don't have to add a margin, and so you're just targeting the tumor. What does this mean? It means, first of all, you can deliver a higher dose, which means you've got a better chance of destroying the tumor that you're treating. But secondly, your normal tissue is getting less dose. And that means often that you don't need to split the treatment up into multiple fractions. Some of these radiotherapy treatments can last for 7 weeks, where the patient has to attend the clinic every single day. But with radiosurgery, because we're it's so precise, and because we're avoiding so much normal tissue, we're able to deliver the same treatment sometimes in just one day. So this can be a one-day treatment that can transform the patient's life. And with the CyberKnife S7, I think one of the main advantages is the advent of the precision planning system, because all of these treatments, you've got to simulate them in advance using powerful computers and graphics. And that's very difficult to do, particularly with a device as complex as the CyberKnife. But with the new precision planning system, it's become much, much easier to do that, and the quality of the treatment plans are significantly higher than previous models of the CyberKnife. So sometimes it's just in the computing power and the advent of AI that's actually making the huge leaps in qualities of treatment nowadays. So I would like to thank Apollo Hospitals for inviting me and allowing me to share this great event with all of you. And I look forward to the academic event this evening. And that is really important. To combine state-of-the-art technology with academia is really, really important, because it's no good having the best device in class if you don't have the knowledge and expertise together. And it's the fusion of the two that creates excellent treatments for the population of Bangalore. Thank you very much for your attention.
It was a perfect talk, Dr. Parekh. Now the floor is open for questions from the media. Hello?
Sir, Madhavan sir, already introduced in Chennai this CyberKnife, sir? Yeah. No, already you introduced the CyberKnife in Chennai, or this is the first time in Bangalore?
So in 2009, we had introduced CyberKnife, the whole-body robotic radiosurgery system, to India. We redefined that in 2023 last year and introduced the CyberKnife S7. The same system today, which is state-of-the-art, is available in Bangalore with an educational program, the Academia, where we'll not only treat, but we'll also train the future radiosurgery clinicians. So that more systems can be installed across India and more people can benefit out of this.
Elaborate about the training.
So in a partnership with Accuray, there'll be clinicians and physicists and others who will be selected and will undergo a training program so they can go back to centers where there could be a need of radiosurgery to start a radiosurgery program and probably increase the number of robotic radiosurgery systems that a country like India needs with a population of 1.4 billion. It's taken such a long time for Bangalore to get the latest CyberKnife system. We are fortunate, but there are so many other cities where they do not have the system today. So once you train them, they could go back and provide the access to care.
My question is, how much does this treatment cost, and what is Apollo planning to do to make this treatment accessible to people who are in need of it but cannot afford it?
Like most treatments in the world, the cost of treatment in India for us Indians is that we are fortunate that it's not even 1/10 of what it is. It roughly costs a patient based on the type of tumor he or she presents and the number of fractions given, anywhere between 3 to 4.5, 5 lakh rupees is the cost. For patients who have to access the program is recognized by the central government, by the state government, by most public sectors, insurance programs, and we also have a collaboration with multiple countries and multiple insurance globally. The benefit today is the total duration taken by the patient for treatment is anywhere between 1 fraction to 5 fractions, so probably 1 visit to 5. And the outcomes to this are measurable, which in the scientific program this evening, our clinicians will talk. So access is available across multiple formats of payments.
Hello. Sir, how this CyberKnife robotic surgery is better than other robotic surgeries?
You have a specialist, Dr. Ian, here, and nobody better than him to talk about it.
Ian, the question is about other radiation modalities and surgery.
Why is it better than others?
There are pros and cons to many different radiosurgery devices. But I think CyberKnife beautifully can treat the brain and the body. There are some specialized techniques that just treat the brain. But in terms of treating brain and body, the CyberKnife is a fantastic machine for that.
Ian, can I just... So, Ian, as a follow-up to that question, even though we've been talking a lot about oncology, there are some benign indications as well, right? Acoustic neuromas, where the precision of the CyberKnife is a great advantage over surgery, right? Can you talk a little bit about some other indications that CyberKnife is useful?
Yeah, certainly. Well, meningiomas is one that comes to mind. So meningiomas, again, are benign tumours, and a lot of patients can be treated just with a single fraction of radiosurgery, as opposed to conventional surgery, where you have the associated morbidity and complications that can come with that. But it can also be used to treat vascular abnormalities like AVMs and even functional treatments. So this is where you don't even have a tumour. You have a part of the brain that's not maybe functioning as it should do. For instance, the treatment of trigeminal neuralgia. And there you're being so accurate, you're actually targeting one of the cranial nerves, the 5th cranial nerve in the brain. And the treatment is so accurate that it can give a very, very high dose to that cranial nerve and a negligible dose to the surrounding tissue.
How much session is required for the one surgery? Means only single session or the multiple session like a chemotherapy?
So typically it's between 1 and 5 sessions. For functional radiosurgery, it is a single session.
And as sir told that one session cost 3 to 4 lakhs. No, it's whole surgery.
So the cost of the treatment is based on the type of tumor and the number of fractions we give. So it differs from patient to patient and how the clinicians diagnose and identify the treatment modality.
How much time person will need for the get normal?
I think it's approximately between 15 to 20 minutes.
After surgery?
No, the treatment on the CyberKnife per patient is about 15 to 20 minutes.
Okay.
Sir, Bharat from Hosadiganta Print Media. CyberKnife ಅನ್ನೋದು ಕರ್ನಾಟಕಕ್ಕೆ ಇದು ಈ ವರ್ಷ ಪ್ರಥಮವಾಗಿ ಎಂಟ್ರಿ ಆಗ್ತಿದೆಯಾ ಅಥವಾ ಹಿಂದೆನೇ ಬಂದಿತ್ತಾ ಅನ್ನುವಂಥದ್ದು ಮತ್ತೆ ಓವರ್ ಆಲ್ ಇಂಡಿಯಾದಲ್ಲಿ ಎಷ್ಟು ಕಡೆ ಈ ಒಂದು ಚಿಕಿತ್ಸೆ ಅನ್ನುವಂಥದ್ದು ಲಭ್ಯ ಅನ್ನೋದು ನನ್ನ ಪ್ರಶ್ನೆ.
ಈ CyberKnife S7 ಬಂದ್ಬಿಟ್ಟು ಬೆಂಗಳೂರಿಗೆ ಇವತ್ತು ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ತಾ ಇರೋದು. ಇದೇ ಟೆಕ್ನಾಲಜಿ ಅಲ್ಲೇ ಮಾಡೆಲ್ಗಳು ಇಂಡಿಯಾನಲ್ಲಿ ಒಂದು 10-15 ಕಡೆ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಆಗಿದೆ. S7 FIM ಚೆನ್ನೈನಲ್ಲಿದೆ, ಬೆಂಗಳೂರಲ್ಲಿ ಇವಾಗ ಹೊಸದಾಗಿ ಬರ್ತಾ ಇರೋದು. ಒಂದು 2-3 ಕಡೆ ಇಂಡಿಯಾನಲ್ಲಿ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಿದ್ದಾರೆ. ಬೆಂಗಳೂರಿನಲ್ಲಿ S7 FIM ಇವತ್ತು ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ತಾ ಇರೋದು. ಇವಾಗ ಸರ್ಜರಿಗೆ ಇವಾಗ ಡಾಕ್ಟರ್ ಇಯನ್ ಪ್ಯಾಡಿಕ್ ಅವರು ಮಾತಾಡಿದ್ರು ಬಿನೈನ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಬಗ್ಗೆ. ಐ ವಿಲ್ ಆಸ್ಕ್ ಹಿಮ್ ಟು ಟಾಕ್ ಅಬೌಟ್ benign indications for CyberKnife. Ian, they'd like to know what all
apart from cancer, does it have any other use?
Yeah,
Applications?
absolutely. So for benign tumours, we talked about vestibular schwannomas or acoustic neuromas, meningiomas, pituitary adenomas, and a whole host of rare benign disease. And then I mentioned vascular malformations, so AVMs, and then the functional treatments, where you're actually targeting areas of neural tissue to alleviate patients from indications like trigeminal neuralgia.
So which country you have brought from this CyberKnife, sir?
Any cardiac application?
Yes, I think, I don't know if, is the Cyber Heart program still going ahead? Because this is really... Okay, so this is a treatment for cardiac for is it atrial fibrillation? Yes, we're actually targeting the area in the heart that produces the additional pulses, which and this is a fantastic use of radiosurgery elsewhere in the body, because this is really a functional treatment, and of course the heart is moving, so you've got to track this target in real time, and that's very difficult. But I think the CyberKnife is the best device for doing that. It's got some very, very nice technology where it can actually track the beating of the heart, so you can actually hit a moving object and still be accurate.
Who will operate this one, sir? Doctor or a technician?
So it's a team approach. The machine is operated by a technologist called a radiation technologist. The planning and the type of treatment to be rendered is by the clinician, who is a radiation oncologist, and the physicist.
First of all, salutations to the greater Apollo family. Dr. Parik, thank you. First of all, welcome to Bangalore. I'm Dr. Simha, I'm a surgeon at Apollo Hospitals. Living is important. Living well is also important. Let me put a small scenario. I'm a colorectal surgeon. There is an early rectal cancer in the back passage. The surgical option is to take the back passage out. What is the equipoise that we draw between a stereotactic radiosurgery and cure this lesion rather than putting a patient through an operation where he loses back passage? Thank you.
Gosh. One of the things I like about radiosurgery is to a certain extent it follows the Hippocratic Oath, which is first do no harm. And so it really is minimally invasive. But of course, every indication, the treatment options have to be weighed by the clinician involved. And I think it's fantastic that there's such a training program here, because it's often the referring clinician that needs to know the pros and cons of radiosurgery versus conventional surgery. And it's really important that anyone that refers into this program is also trained to some extent, so that they can make that educated evaluation. I hope that answered your question, sort of.
Problem agalva idal baro radiation inda
Asking if there's going to be radiation-led induced secondary cancers.
That's a very good point. That needs to be weighed when you're considering conventional surgery versus radiosurgery, and it depends what dose you're using and also how young the patient is. So that's something that you need to consider when you're treating a very young patient. But if you're treating an older patient, they tend to have less years in which to develop that secondary cancer from the radiation that they've absorbed during that treatment. But we must remember that there is background radiation everywhere. So actually the background dose and the increase in the risk of secondary radiation in most cases is minimal compared with the overall risks of surgery.
ಇದು ಏರ್ ಲಾಸಸ್ಸು ಸ್ಕಿನ್ ಇಚಸ್ಸು ಇದು ರಿಡಿಷನ್ಸ್ ಎಲ್ಲ ಏನಾರು ಆಗುತ್ತಾ ಅಂದರೆ ಮೊದಲು ಮಾಡ್ತಿದ್ದು ಚಿಕಿತ್ಸೆ ಎಲ್ಲ ಆಯ್ತೈತಲ್ಲ ಆ ಥರ
We have ನಮ್ಮ ರೇಡಿಯೇಷನ್ ಆಂಕಾಲಜಿ ಟೀಮ್ ಅವರು ಇರ್ತಾರೆ ಇವಾಗ ಪ್ರೆಸ್ ಮೀಟ್ ಆದಮೇಲೆ ಐ ವಿಲ್ ರಿಕ್ವೆಸ್ಟ್ ದ ಮೀಡಿಯಾ ಟು get in typical questions on skin, radiation, toxicity and others. On a clinical one-on-one, I'll request Dr. Sridhar or Dr. Vikram to stay back and address in detail these questions. Any other questions from the media?
Hello. Sir, what are the Apollo's future plans for cancer care across the country?
I think Apollo, I'm sure and I'm saying this, Apollo is very committed to cancer care across India. And we will step up the program in our existing hospitals. We will be building new cancer centers in multiple locations. And there will be dedicated beds for cancer. That we will do consistently and continuously. The investment into technology, as you saw, we've done this today, and we're doing the CyberKnife. But the proton technology now has been proven a success, and there are smarter, quicker ways to do it. You know, there's newer technology available globally. So we're now in talks with multiple providers, research units to try and tell us which is the best for us to do, which is accurate and cost effective, and we will be doing multiple formats in different parts of the country. Right now our strategy has identified 3 locations, so we will be rolling that out in a phased manner. We will be adding pure cancer beds, a minimum of 500 in the next 12 months. But we will step up the oncology program simply because the problem of the disease is huge. And every hospital of ours which does not have a very strong, like for example in Trichy we don't have a LINAC, but we will be installing that. And in Chennai itself we've got oncology in 3 locations. So we're going to keep doing it, and I'm sure in the city of Bangalore a minimum of 3 locations which will be doing high-end cancer work.
Just to add to Ms. Preeta, for people who are interested in the number of centers we do in Karnataka, we are currently building capacity in Mysore. And this coming January, we'll inaugurate the Comprehensive Cancer Center in Mysore, just to let you know our footprint increase for the state.
If I can just add to what Ms. Preeta said, we have very bold visionary plans for how we will treat cancer, including more infrastructure, more investment in technology, and more importantly, also hiring the high-end doctors who would provide that care. But I also want to note that the most effective treatment for cancer occurs when it's detected early. So critical to cancer is having robust early detection programs. That includes breast cancer, colon cancer screening, lung cancer screening now for patients who are high risk using low-dose CT. So our ProHealth program, which was a vision of the chairman, has a very, very strong emphasis on screening for cancer. So I would say that one of the biggest areas of impact for Apollo will be scaling up our ProHealth health checkup to include screening for cancer, and adding more screening programs, including lung cancer screening, such as low-dose CT.
How many patients have been treated with this treatment till now in India, and what has been the success rate?
I do not have the exact details of multiple centers' success rate. I could talk to you about the outcomes at Apollo in Chennai. But my thinking between the number of CyberKnife centers which are there in India, probably somewhere with the range of 50,000 plus patients would have probably been treated. I think the measurable outcomes that the teams have got, I will get on your email ID and mail it across. It's far superior than conventional radio surgery or radiation. And that's what has made us think beyond what we were doing in one city to establish multiple CyberKnife programs, because we are clearly seeing it to be a game changer. Thank you.
Sir, North Karnataka ಏನಾದರೂ ಪ್ಲಾನಿಂಗ್ ಇದೆಯಾ ಸರ್? ತುಂಬ ಜನ ಹೈದರಾಬಾದ್ ಹೋಗ್ತಾರೆ, ಹುಬ್ಳಿ, ಬೆಲ್ಗಾಂ, ದಟ್ ಸೈಡ್ ಏನಾದ್ರು ಪ್ಲಾನ್ ಇದೆಯಾ ನಿಮ್ಮದು? ಯಾಕಂದರೆ ಆ ಕಡೆ ಪೇಷಂಟ್ಸ್ಗಳೆಲ್ಲ ತುಂಬ ಹೈದರಾಬಾದ್ ಕಡೆ ಕಾನ್ಸಂಟ್ರೇಷನ್ ಮಾಡ್ತಾರೆ. ಯಾಕಂದರೆ ಅವ್ರಿಗೆ ಬೆಂಗಳೂರು ಹೈದರಾಬಾದ್ ಸೇಮ್ ಡಿಸ್ಟೆನ್ಸ್.
ನಮ್ಮದು ಹೈದರಾಬಾದ್ನಲ್ಲಿ ಹಾಸ್ಪಿಟಲ್ ಇದೆ. ಸೊ ಪೇಷಂಟ್ಸ್ ನಾರ್ತ್ ಕರ್ನಾಟಕದಿಂದ ಹೈದರಾಬಾದ್ ಬರ್ತಾರೆ ಟ್ರೀಟ್ಮೆಂಟ್ಗೆ. ಇವತ್ತು ಮಾತಾಡೋಕ್ಕೆ ಯಾವುದೊಂದು ಟ್ರೀಟ್ಮೆಂಟ್ ಒಂದು ಸೆಂಟರ್ ಸ್ಟಾರ್ಟ್ ಮಾಡೋಕ್ಕೆ ನಮ್ಮ ಹತ್ರ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಯಾವುದೂ ಸ್ಟಾರ್ಟ್ ಆಗಿಲ್ಲ. ಬಟ್ ಬೆಂಗಳೂರು ನಮ್ಮ 3 ಹಾಸ್ಪಿಟಲ್ ಮತ್ತು ಮೈಸೂರಿನಲ್ಲಿ ಕೊಲಾಬ್ರೇಷನ್ ಪಾರ್ಟ್ನರ್ಶಿಪ್ ಮಾಡ್ಕೊಂಡು ಪೇಷಂಟ್ಸ್ಗೆ ಆ್ಯಕ್ಸಸ್ಸು ನಮ್ಮ ಡಾಕ್ಟರ್ಸ್ ಅಲ್ಲಿ ಹೋಗ್ಬಿಟ್ಟು ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ತಾರೆ. ಬಹುಶಃ ಇನ್ನೊಂದು ಸತಿ ನಾವು ಪ್ರೆಸ್ ಮೀಟ್ ಮಾಡುವಾಗ ನಾರ್ತ್ ಕರ್ನಾಟಕ ಬಗ್ಗೆ ನಮ್ಮ ಎಕ್ಸ್ಪ್ಯಾನ್ಷನ್ ಪ್ಲ್ಯಾನ್ಸ್ ಮಾತಾಡ್ಬೋದು. We do not have a presence in Bangalore yet.
I have another question. With the introduction of such technology in India, how do you think will it impact medical tourism? Medical tourism.
Medical value travel in this part of the world, that's I'm talking about South Asia, India is in the epicenter of it, seeing the largest number of patients. We see close to about 40,000 plus patients coming in from just our neighboring country, Bangladesh, on it. Technologies like this today is not there in Sri Lanka, Maldives, Afghanistan, Bangladesh, to name a few, or Sub-Saharan Africa. So patients will access it. One of the things that it will do for the state of Karnataka is to have people access the program here. It will also help in improving the access to care for countries which do not have the treatment, and also will help in the growth of the healthcare economy.
Hi, I'm Shivram from Indian Express. So how effective is this treatment for patients with stage 4 cancer?
Stage 4 cancer.
Well, one of the amazing treatments that we can now deliver is radiosurgery for brain metastases, which used to be a death sentence for patients. And not just solitary brain metastases. I was actually involved in the UK in treating the first double-digit brain metastasis treatment. So this was a lady with 10 brain metastases from breast cancer. She had twins that were 2.5 years of age, and she was told by her oncologist that she had less than 6 months to live. And initially we were not going to treat the patient because 10 brain mets, that's something that you don't deliver with radiosurgery. And she refused to have the stereotactic frame taken off her head. She said, no, you can take it off when you treat me. I'm not going to leave this hospital untreated. And we gave in and we treated the patient, and she was alive 10 years later, which just really amazed us. And certainly the increase in radiosurgery worldwide has come about with the increase of radiosurgery for brain metastases. And we can have incredible results in that respect, control the disease. And with the advent of immunotherapy and systemic therapies, patients can live a long time now, even though they've been diagnosed with brain metastases.
What is the success rate, sir? Percentage?
It will depend on the primary disease. It will depend on the number of the volume of metastases. It will depend on the size of the metastases. But certainly we can expect a 95% control rate if a patient is diagnosed with small metastases. That may go down, but it's still a far better treatment. We would use it when it's a far better treatment than any other option, and most of the time it's far more effective than whole brain radiotherapy with less side effects.
So one more technical question. Why is it called a CyberKnife? What exactly is a CyberKnife?
That's a good question. Well, I think when the CyberKnife was named, there was another radiosurgery device, the Gamma Knife, and the Gamma Knife was named the Gamma Knife because it was kind of a knife, because you were being very, very precise, and you could destroy areas of normal brain or tumor, just like removing that lesion with a scalpel. So that's where the knife came in. And then the CyberKnife, I guess it's electronic, while the Gamma Knife was using cobalt radiation and gamma rays from that cobalt radiation. I think that's the reason why it's been called the CyberKnife.
Thank you, sir.
I'm just mindful of the time. If there's no more questions, we'd like to move on to the next session with Dr. Vikram. Most of our clinicians and the physicists will be there. You can ask questions regarding the technical question on disease control outcome. You have heard it from the president of the British Radiosurgery Society, who has practiced under the NHS on multiple systems, be it a Gamma Knife or a CyberKnife, or what radiosurgery can do. And for those in the media who are interested, there's a scientific session this evening, which starts at 6. I would welcome you to the program for you to understand more on the science and outcomes of CyberKnife. Vikram, over to you.
We will be available later on, myself, Dr. Vikram Maya, Dr. Sridhar, Dr. Vijay Bhaskar, everybody will be available for all your technical questions and clinical options, along with our physicist, Dr. Ian Paddock also. I think we would, in the interest of time, would like to move on. Now I would like to request Mr. Harshad Reddy, he's our Director, Apollo Oncology and Internationals, Apollo Group, to let us know the way forward and address the gathering.
Good afternoon, ladies and gentlemen. As I draw this meeting to a close, it's been a gathering that's been filled with hope and positivity. And I do echo the sentiments of Dr. Ian Paddock, where he said the future is bright. I think we all believe that at the Apollo Hospitals Network, and that's why we go to work to serve our beloved patients. Sir, I'd like to thank you for your presence today. A long flight in from London and a meeting early in the afternoon. It really was a pleasure and a privilege to interact with you. I'm sure the scientific session later this evening would be a really engaging interaction with our respected oncologists as well. And I wish you the very best for the rest of the day and your trip. Ms. Preeta Reddy, our guiding force, along with our beloved chairman, who's not here today. We thank you for your presence and your support. Mr. Dinesh Madhavan, Dr. Madhush Sashidhar, thank you as well. A note of appreciation for our senior oncologists, who I personally believe are the best in the world, and we're extremely proud and privileged that they're a part of the Apollo network and who continue to serve our patients. So we thank you once again for everything that you do for us and our organization, and most importantly, our patients. My other beloved members from the Apollo family, I know what we go through every day at work, but it really has been such an amazing journey for all of us, and continue to do what you do and giving it your all for our patients. Thank you once again. Beloved members from the media, we sincerely appreciate your time here, And we urge you to communicate to the public about the importance of early screening and detection of cancer, about cancer being conquerable, and that, you know, right here at your doorstep in Karnataka, you have the best-in-class technology as well. Please do use your power, your muscle to communicate this to our beloved citizens, which we believe is very important. And we thank you once again for your support. We would also like to communicate to everyone that Karnataka is a very important part of the group's growth initiatives. You are going to see that we're going to be building quality assets manned by the best-in-class doctors to ultimately serve our citizens better. So we thank you once again and look forward to interacting more in the future.
Before we close it up for lunch, I would request for a photo session, Dr. Sridhar, Dr. Manish, Dr. Vinay, Dr. Vijay Bhaskar, please come on the dais. We can have a photo session. Yeah, the Accurate team, please. Any of the media persons want to ask any questions? Myself, Dr. Vikram Maya, Dr. Sridhar, and Vijay Bhaskar and Vinay, we are there for around. Thank you. The lunch is open. Yeah, the academics is a very, very important thing.
I'm heading to Delhi tomorrow for a different event, then I go back to Chennai.
You're staying back for the scientific session?
Do the scientific
Go
session.
back tomorrow. World Sarcoma Day.
Oh yeah, tomorrow is World Sarcoma.